Hi, I'm Barb Welch. I'm the director of the laboratory at Crossing Rivers Health. I've been the director for over 8 years, and I've been employed at this organization for over 26 years. I love what I do at Crossing Rivers Health because the laboratory supports patient care by giving providers the crucial information they need for the detection, diagnosis, and treatment of disease. Every day is a different experience. It's full of challenges, and I get to work with wonderful, caring people every day. When I started here in 1989, some of the changes I've seen over the years, back then we had 5 lab staff. We covered the lab, taking call on weekends and nights. Now we have 13 staff in the lab, and we have in-house coverage 24/7, 365 days a year. Back then, everything was on paper. We had orders written on paper, our results were handwritten on paper, and we had to walk them up to the nurse's station to be put on the charts. Now all those results and orders are done through the computer system electronically, and the results are instantly available to the provider as they're completed. Lab technology has changed over the years significantly. There's smaller sample sizes, faster results, increased automation, sophisticated software, molecular technology, to name a few things. Some of the most memorable organizational changes over the years was our conversion from paper to electronic health records, our lean and service excellence initiatives that give frontline staff involvement in problem solving and performance improvement and patient satisfaction, and our new medical center, which was a great opportunity for us to be able to plan the most state-of-the-art patient-centered facility for our community. Some of the influential people I remember in my early years were Kelly Munt and Rick Walters. They were great mentors. As a new to the profession, they were able to teach me a lot about the lab that I didn't learn in school. One of the most memorable experiences I had with Rick was when I was a new tech. One of my first weekends working alone, we had a patient come through the ER with an aneurysm. They needed stat blood transfusions. I called Rick at home and he said, "I'm coming," and he was there, right there. We worked together. We were able to provide 20 units of blood for that patient, and that patient miraculously survived with the help of the surgeons that were able to contain the bleeding. And it was a great feeling looking back, seeing that patient in the community years later living a productive life and knowing that I had helped him even though he had no idea who I was or how I was involved. When I started here in 1989, I was excited because I was coming home closer to my hometown to be with my family, but I didn't know that Crossing Rivers Health and the people that work here were going to become my other family as well.